We're at the Fetal Evaluation Clinic at Tygerberg Hospital. I am a registered professional nurse as well as a midwife. We do about 4,000 Dopplers a year, and I see about 670 patients per month that come from the midwife obstetric units as well as the rural hospitals.
I was sent by the Bishop Levis Day Hospital telling me that the baby was not growing well. So that's why I'm here today.
A lot of these patients are sent for poor SF growth, and as soon as you have poor SF growth, you must determine if this is a baby having a problem or is this a normal small baby. And we do the necessary testing, and then they are sent back to their referring clinics.
At the moment, the high referral rates mean that 9 out of 10 patients are being referred for really no reason. And that has a big impact in terms of the kind of trauma that the patient feels. They actually have to take days off work. It's sometimes several days before they can see the specialist at the secondary care level.
Annalisa, you can just come along and every patient that come here, I start off with an antenatal card from the sister that saw her the first time. I use that as my starting point. And from there, I work out what is the gestational age and what is the problem now. And then you do the appropriate testing on that. The only thing that we determine with doing a Doppler is what is the placental's function. Is this placenta that is giving food and oxygen to the baby, is it working properly or is it not working properly? And the placenta is not working properly, we know there's placental insufficiency. So this placenta is not giving enough blood to your baby to grow well. And then we know we can intervene in certain times. And it gives us a resistance of 0.61, so that is normal. The midwife obstetric units, they really have nothing. They really, the only thing that the registered nurses there have is the tape. If you had your Umbiflow, you would be doing that. So the nurse will see the patients there, and if everything is normal, they can just go home. So they would never come in a system that is a higher level of care that's much more expensive.
Umbiflow measures the blood flow in the umbilical cord of the fetus. Now, using ultrasound to do that is obviously not new, it has been done before. What we have done that's unique is to actually take that approach and build it into a single system that's able to be used by people like midwives. So in essence, a very specialized unit, very simple to use and very low cost, but it's actually able to give you that diagnostic measurement at the primary healthcare level. Umbiflow consists of an ultrasound probe, which has a transmitter-receiver section at the front. It has some basic electronics and signal processing inside, then connects with a cable into the USB port of a computer. It uses the cable for data transfer as well as powering itself directly from the computer. On the computer itself, we have got software that receives the signals, does signal processing, and eventually calculates an index for the healthcare worker. That index actually tells you whether or not the fetus has a problem in the womb or not. And that diagnostic measurement is all done automatically on the computer. The computer will display the Doppler waveform, showing you how the blood is flowing, and based on that picture, the healthcare worker knows they've got the correct signal.
Having this mobile device, it's very handy because when you have patients that are severely ill in a labor ward with eclampsia or severe preeclampsia, you cannot transport those patients, that you then can go and do the Doppler with the mobile unit. With this device, it would be much easier to go and do those kind of patients in wards.
By putting Umbiflow into the primary healthcare system, in excess of 3,000 children a year will be saved simply because they have access to this measurement.
To evaluate the device, we conducted a clinical study at the hospital in the perinatal mortality unit, whereby we used one of the gold standard sophisticated, very expensive units to see whether our device would provide the same resistance index. And we did this on hundreds and hundreds of pregnant women over a period of time, and discovered an extremely good correlation between the so-called gold standard device and our very simple device.